Our project is Tricare. I'm Dave.
I'm Latrice. I'm Kelly. I'm Emily.
Tricare is the health insurance system used by military
Personnel and their dependents.
Tricare is an insurance that serves military personnel and their immediate family. There are 3 major types of Tricare that the military can choose from, such as Tricare Prime, Tricare Select, and Tricare Extra with Supplement. This insurance affects many different social, economic, and spiritual backgrounds, with the military being so diverse with the people it serves. Even with this insurance needing to be used all over the world, there are some stipulations on where the insurance can be used. There are many benefits to having Tricare, but there are also many restraints.
Tricare offers benefits to active duty personnel and other beneficiaries, including dependents of active duty personnel, military retirees, and dependents of retirees. Dependents are the children and spouses or other family members of these people that are serving or have served in the military. Tricare also offers 3 different types of coverage for military personnel that is based off of eligibility, as well as gives choice for someone to choose what coverage best suits their current status. The first is for active duty personnel, retirees, and dependents under the age of 65. This is known as Tricare Prime and is a managed care option, and because so, it is letting the covered individual access care which is within the Tricare network. If not eligible or choosing against enrolling for Tricare Prime, the person would then be able to choose between the second and third options. The second option is Tricare Standard, and it is a fee-for-service option that allows the individual to pay for certain services separately and for others so that they can avoid bundled costs which would cause them to pay more. The final option is Tricare Extra, which is a preferred provider option, allowing the customer to pay less to the physician or hospital that is within the organization's network.
The biggest economic factor that led to the creation of Tricare was the increasingly expensive cost of health insurance and the lack of coverage for those in the military and previously in the military. The government wanted to reduce the amount of people without insurance while also helping to cover the military in order to thank them for their service to the country. A big priority throughout the history of the United States has been defense and protecting the country. The enactment of Tricare would allow the government to provide the military with the required trained medical corps to support the troops in both times of peace and in combat. This helps to explain the main goal of Tricare, which was to allow each military department to focus on its needs and strengths and to improve communication, coordination, sharing, and planning among the services and enhance beneficiary access to care throughout the military. Tricare allowed the military to focus on defending the country without worrying about how they would afford coverage. There was also a political reason the government wanted to create Tricare. Lobbying for certain groups of people can help to attain their trust. Politicians need trust and backing in order to be elected and re-elected to office. Veterans and active military make up 13% of the voting population, enjoy a high voter turnout, and are especially concentrated in some decisive swing states. These statistics show how important their vote is, and in return helps to give reason why politically Tricare's formation was supported.
The Tricare population navigates the United States healthcare system in a variety of ways. Beneficiaries can receive care through civilian providers reimbursed by Tricare, which is known as purchased care, or patients can receive care from hospitals and clinics operated by the Uniformed Services, which is known as direct care. Patients in the Tricare population can navigate the system much like patients with employer-sponsored insurance, Medicare, Medicaid, or any other insurance type through purchased care. Patients utilizing direct care are provided services within military treatment facilities, which means the Department of Defense can manage healthcare service delivery to the Tricare population. The DoD aims at providing high-quality and cost-efficient treatment for Tricare recipients, but access becomes a major issue. Although there are nearly 500 hospitals and medical clinics in the military health system in the United States, many beneficiaries are not able to get the health care they need from those facilities. Most of those facilities are located on or near military installations. This map displays the military treatment facilities across the United States. This is just for the Air Force, but it gives you a general idea. Although there are many, not all Tricare recipients live near these facilities. Take Missouri for example. If you live in Springfield, Missouri, to access the military treatment facilities is a hefty drive. Decreased access can negatively impact care. This survey shows that in 2011, patients of direct care were only 57% satisfied in their access to and experience with healthcare services, whereas patients of purchased care rated their experience much higher at 80%. Since military treatment facilities are so far away, patients who use direct care may then avoid seeking treatment due to limited access. Avoiding treatment can be detrimental to a patient's preventative care. They may only seek care when a problem is persistently wrong, and by then it is sure to be much worse. It is then not a simple trip in the car, but a trek in a less than preferred state of health. The type of Tricare plan a patient obtains determines what care system they are eligible to utilize. In Tricare Prime, patients are required to utilize military treatment facilities when those facilities are available. If they want to utilize a civilian provider outside the Tricare system, they must obtain specific permission to do so. Although Tricare Prime is the most affordable of Tricare plans, it lacks in other areas and leaves active duty service members with difficulty obtaining care.
Tricare is an insurance that has many different advantages and is built for the military. Tricare can be used anywhere in the country and can even be used overseas. With these positives, there are a few negatives that come along with using Tricare. To get treatment at a hospital outside of a military installation, a patient needs to get it approved by their PCM or their primary care manager. This shows that there is a slowdown in the process of treatment. Although with this limitation, Tricare is an insurance that allows a lot of access to many people at high quality.